this presentation, I'm going to go over some of the different community resources that I researched for the city of Meadville, Pennsylvania. Throughout my research, I found many different types of resources. These resources included some childcare and early learning services, and those included the Meadville Family YMCA as well as the Early Learning Resource Center. Different development and intervention resources that I found were the Crawford County Early Intervention and Comprehensive Children and Family Services. Different support and services include the Crawford County Human Services and the Crawford County Children and Youth Services, so that would be like the CYS. Some other helpful resources that I found just for anybody in need were the Imagination Station Park and Playground, as well as the Crawford County Court-appointed special advocates for any children that are in the foster care service and might need somebody like this. These are just a couple of the different types of resources that I found. I'm sure there are plenty more out there, but these are the very easily accessible ones that I found. Some of the different services that are offered through these resources, these can include different licensed childcare for both infants and toddlers, some financial assistance options, so these include the scholarships and financial aid through different facilities here, some assistance for finding and paying for childcare, because we all know that childcare can become very pricey, different voluntary services to children with developmental concerns, services for children with mental, emotional, or behavioral health needs, services and support for families to help maintain a safe and healthy home environment, a local park, and once again, the court-appointed special advocates for the children in foster care. The first article that I researched, it went through just a little bit about like what they consider vulnerability, and some of the indicators that make somebody vulnerable, and like the different key points to vulnerability indicators. So this article summarized vulnerability up to be shaped by different things such as maternal deprivation, emotional adversity, social exclusion, and environmental risks. This article went into the point to make that vulnerability is not just individual behaviors or traits. It could be caused or shaped by many different things. Some of the key vulnerability indicators, these included orphanhood, chronic illness, disability, poverty, inadequate housing, lack of education, exposure to abuse, and limited access to essential services. The article stated that existing tools were inconsistent and insufficient. And it pointed out the need for standardized, validated scales, and that is for assessing youth vulnerability and determining who is considered vulnerable. In the second article, it did a research study on a little over 40,000 people, and they ranged from ages 13 to 18, and throughout that study, 29.7% reported at least one of the 5 assessed health vulnerabilities, and 7.9% reported 2 or more. And out of those 5 vulnerabilities that were studied, included tobacco use, other substance use, firearm access, condomless intercourse, and depressive symptoms. Also looking in this study, those studied ages between 16 and 18 years old they were significantly more likely to have at least two or more of the vulnerabilities compared to those younger ages. So that would be the ages of 13 to 15. Some of the projected outcomes and kind of recommendations from this article to decrease those vulnerabilities were primary care for adolescents should be more tailored in community-informed care, and that neighborhood level interventions and policies could help decrease these risks. In my third article, it researched and looked into how both the very young and the very old population can be considered vulnerable, and it also looked into specifically how they can become vulnerable when it comes down to dental care. Throughout research, it was concluded that delayed first dental visits until at least the age of 4 um, can dramatically higher the risks of them having dental caries, and that is compared to those who were seen and had their first dental visit at the age of 1. This article also stated that many dentists are advising people to delay their children's first dental visit until the age of 3, and not have them seen by the age of 1. The article made the point that the dentists are delaying these children's visits until they're at least 3 years old, um, and that dentists are hesitant to work with these children because of their childish behaviors and the potential for behavioral complications or scarring of the children and making them scared of the dentist. And this article also looked into different parent point of views, and the parents of the autistic children have reported significant barriers to dental care, and that's mainly due to behavioral reasons. And these 3 sources here are the sources that I used in my 3 articles, and they are all linked here. And if you have any questions, let me know, and I hope you enjoyed. Thank you.